Good morning, Rob and fellow students. My name is Noelle Chapman, and today I'll be presenting to you the placement and project-related aspects of my placement. Placement-related aspects will include the background of workplace, populations, tasks completed and observed, my contribution to the workplace, the value of placement, the specific learnings that took place, my skill development, and future pathways. My 40-hour placement was completed with Activate Health Exercise Physiologist. Activate Health provides exercise physiologist services to the Yeppoon region. They were established in 2011 and have a great reputation within the community. Activate Health is owned and run by Kate, who is a sole exercise physiologist and has one receptionist to help with administration tasks. Activate Health services consist of individual and group training sessions, home visits, and at-home and gym programs. The target population of Activate Health is those looking at optimising health and well-being and regaining function and ability. During my 40-hour placement, I had the opportunity to work with a number of populations, including war veterans, diabetics, and those with osteoarthritis. One population I worked with were war veterans. This was one clientele base I was not expecting to work with. The clients in this population were males and aged 60 to 80 years old. The at-risk symptoms included post-traumatic stress disorder, with some also having decreased function and ability, depression, reduced quality of life, and pain. The population I had the most exposure to was those with osteoarthritis. This population included males and females aged 50 to 80 years old. This population presented with symptoms of pain, decreased muscle strength, reduced functional capacity, and the ability to perform daily tasks like grocery shopping, cleaning the house, or even hanging the washing out. A large proportion also suffered from hypertension, high cholesterol, and diabetes. Home and gym programs were designed to meet specific needs of this client base. Another population I had experience with were type 2 diabetics. This population includes both males and females aged 50 to 75 years old. This population usually presents with a number of at-risk symptoms, including being newly diagnosed and not knowing the benefits of physical activity on blood glucose levels. The majority are overweight or obese, living sedentary lifestyles. Additionally, some also present with high blood pressure and cholesterol. Due to this placement being purely observational, I was limited to the amount of hands-on tasks I could complete. During assessment of posture, my supervisor allowed me to use information I learnt through course material to assess one's posture initially. Following this, my supervisor would then go and assess the posture and explain any additional observations that I had missed. I also filled in program cards at the end of each session. Other than this, the remaining tasks were purely observational, including the observation of pre-exercise medical questionnaire being filled out and discussed, the development of an exercise program that was tailored according to special considerations and to be individualized accordingly to individual needs, the implementation of exercise program to individuals, and technical cues given to improve technique, the progression of exercise programs to enable clients to continually improve, tests to assess range of movement, including the back scratch and sit and reach test. During my placement, I was able to contribute to the workplace by reviewing a marketing leaflet to promote Activate Health. I provided feedback on areas that were good and gave suggestions for improvement. I also gave feedback on a handout sheet designed for the diabetic workshop. Suggestions were given on areas that could be improved. At the start of each session, I organised the equipment we needed and gave it a quick serviceability check to ensure it was in okay condition to use. I further contributed by filling out the program cards at the end of each session and filing them away in appropriate folders. The final contribution to the workplace was when I noticed a need for the consultation form with specific areas to write in instead of just scribble everywhere. I brought forward this idea to my supervisor, which streamlined the consultation process and reviewing at a later date. The specific learning that took place within my 40 hours included the exercise fit recommendations for each population I worked with, that each client's needs are different and programs need to be individualized accordingly, a variety of new exercises including Swiss ball and resistant band exercises. I learned a variety of progressions and regressions for each exercise. I learned that there are many different personalities that you will encounter. Finally, how a program card works and the importance of keeping a record of what happens during each session. Through observation, I developed skills like how to apply fit recommendations for exercise prescription. By listening to my supervisor communicate and observing how she interacted with patients, I was able to develop the ability to communicate and interact with a variety of personalities. The ability to integrate my postural knowledge from course material and assess posture during client assessments has developed my skills in postural assessment. The final skill that was developed was the ability to develop an exercise program to meet specific needs. Activate Health has provided an excellent learning environment. Kate was enthusiastic to share her knowledge and build my skills in clinical exercise prescription, which was invaluable and an experience I don't believe I would have received elsewhere. I believe my placement has allowed me to develop efficient communication skills to interact with a diverse range of personalities. Placement has allowed me to gain industry-specific knowledge needed to work professionally with patients and staff in a variety of clinical settings. This will be invaluable knowledge to commence a master's degree in exercise physiology next year. My experience at Activate Health has confirmed that I still want to pursue a career in exercise physiology. However, it has also made me realise a population that is dominated by an older generation is not for me. As a result of my placement, I have two future career options to consider. The first is a role where I am preventing the issue before it occurs, such as assessing different parts of manual handling in the workplace. The second is that I could look at specialising in rehabilitating sporting injuries, which would hopefully elicit a younger population. So project-related aspects will look at effects of inactivity on health, efficiency of exercise in preventing and treating this disease, methods used to collect information, a description of project setting, health screening and risk assessment, physiological assessment, exercise program, reassessment and feedback, discussion, conclusion and practical implications. My project was on exercise prescription for the treatment of osteoarthritis in the elderly. There are a number of effects inactivity has on the health of elderly with osteoarthritis. Holler and others found that joint pain is a major contributing factor to inactivity in those with osteoarthritis. They found that osteoarthritis is linked to pain coping strategies where physical activity is avoided to prevent pain from occurring. Additionally, joint pain has been linked to depression in this population. The avoidance of physical activity and psychological dysfunction are the major contributing factors to the development of sarcopenia. Sarcopenia is the loss of skeletal muscle mass and is a major cause of muscle weakness in the elderly. This presents a problem to those with osteoarthritis as muscles have an integral role in the structure and function of the joints according to Powell and others. Consequently, the deterioration of the musculoskeletal system has adverse effects on locomotion, the ability to maintain posture and flexibility. Ciaccio and others found a notable change in locomotion of gait, postural sway in osteoarthritic elderly, and reduced range of motion, causing a decrease in balance and greater risk of falls. Therefore, it is important to establish an appropriate treatment and prevention for this disease and health outcomes. The ACSM guidelines suggest that a program that combines resistance, aerobic, and flexibility exercises is beneficial. Recent literature that looks at a trial over 8 weeks with 3 sessions per week found that resistance training increases muscle mass and reduces joint pain. Additionally, Koyalak and others found similar results in a 13-week trial which included 2 sessions per week. However, this study found that there was an increase in muscle strength, a reduction in joint pain, and an increase in balance which resulted in reduced risk of falls. Aerobic exercise. Tanaka and others conducted an 8-week trial with 3 sessions per week, and they found that aerobic exercise helps to improve aerobic capacity and reduces osteoarthritic-related pain. Flexibility exercises. Recent research has found that flexibility exercises help to improve balance, mobility, range of motion, and reduce the number of falls. For prevention of functional incapacity, muscle deterioration, and pain, regular exercise is essential for the elderly with osteoarthritis. However, if exercise is not maintained in this population, the body will not be able to counteract the naturally occurring physiological processes. Consequently, it is crucial for the elderly population to participate in regular exercise to reduce osteoarthritic pain and associated symptoms. Literature was reviewed in September 2015 using ESSC13005 search engine. Databases such as SportsDisc, Medline, ScienceDirect were utilised to search full-text articles related to the relationship between osteoarthritic elderly and exercise. Search terms included osteoarthritis, elderly, exercise, inactivity, strength training, and aerobic training. To ensure literature was creditable and current-only research journals published after 2004 were reviewed. The project was undertaken in the exercise physiology clinic. The elderly were referred through a care plan and entitled to 5 free sessions. A total of 13 osteoarthritic elderly received treatment from the exercise physiologist. Each client had varying levels of functional capacity and exercise was prescribed accordingly. Proper technique was important as sessions were continued at home. pain and rate of perceived exertion were assessed to ensure that the exercise program developed was appropriate. The equipment used during prescription was a Hart Sports green and red resistance band. During placement, all clients were referred by a medical practitioner. Prior to the initial appointment, the referral and medical history were reviewed. Specific questions were asked to gain a general idea of the client's current function and ability. Following this, an ESSA physical activity readiness questionnaire was filled out to provide the practitioner with further information to ensure the client was safe to exercise. The most common physiological tool was the 30-second chair stand, which looked at the lower body strength. That's this one here. The second assessment was the chair sit and reach, which looked at lower body flexibility. The third test that was conducted or observed was the back scratcher test. This looked at upper body flexibility. Exercise programs looked at increasing flexibility, strength and balance, and improving aerobic capacity. A range of resistance band exercises assisted to improve muscular strength, and functional improvement was seen through tasks including sit-to stands and step-up exercises. Dynamic and static stretches were used to improve flexibility and increase range of motion. Walking was used to improve aerobic capacity. This involved the client getting a bit of a puff. The puff was achieved by changing walking intensity or walking along a terrain with small inclines or declines for 5 to 10 minutes. However, this was also achieved through the resistance exercises as a result of severe deconditioning. Additionally, special considerations included the clients were informed that a small amount of discomfort in the joint during exercise was common. However, pain should not increase more than that experienced before exercise. For those clients experiencing extreme discomfort and pain with simple movements such as walking, it was advised that hydrotherapy and warm water would be a more suitable alternative to begin moving. So reassessment and feedback. So reassessment was every 4 weeks. Pain levels were assessed and difficulty with the program were discussed. Based on client information plus the programmer's reassessment, exercise programs were progressed accordingly. The senior fitness test could have been reassessed to establish improvements, however it was not. Feedback was given to improve exercise technique. It is important to keep the feedback simple but descriptive to ensure correct technique transfers into the home environment. Correct technique is important to prevent falls and potential injuries or joint irritation from incorrect movement. Disease education was given to clients struggling with motivation. The physical performance tests observed were part of the senior fitness tests, which are a safe and standardized assessment protocol for providing information about physical fitness in the older generation. Although only 3 tests were used out of this protocol, depending on the population, tests such as the 30-second arm curl, 8 feet up and go, and the 6-minute walk can be used during assessment. For the population observed, only 3 tests were required to gather information on their functional capacity. The frequency, intensity, time, and type recommendations by ACSM were observed throughout placement. Resistance-based strength training has seen improvement in muscle strength and endurance and has been linked to improvement in pain, bone quality, functional performance, postural stability, and falls prevention. The use of resistance band exercises to increase muscle strength and endurance opposed to machine weight exercises has seen a significant improvement in strength and endurance and is a safer alternative for the elderly with osteoarthritis. The use of resistance bands to improve muscular strength was observed during placement and thus incorporated into the home environment. Recent literature has established that aerobic training is an effective treatment of osteoarthritis. Brosiu and Pescatello suggest that walking is an appropriate form of aerobic training and significantly improves functional capacity. Furthermore, activities with high impact should be avoided if the lower body is affected by osteoarthritis. In line with literature, the observation of walking intervals prescribed to clients was to increase function and mobility appears to be an appropriate tool for the treatment of osteoarthritis in the elderly. On the other hand, literature has demonstrated that an exercise program that combines both strength and flexibility training can improve pain, muscle strength, muscle mass, balance, mobility, flexibility in the elderly. Flexibility was observed during the exercise program through the use of dynamic and static stretches. The conclusion of this project is that the most appropriate treatment for osteoarthritis in the elderly is exercise therapy. The functional decline associated with osteoarthritis can be prevented through participation in regular exercise. Exercise prescription that incorporates aerobic, resistance, and flexibility exercises is most efficient in improving functional performance in the elderly with osteoarthritis. So, practical implications. The exercises should be easy and simple to follow. to ensure correct technique is transferred into the home environment. Progression of exercise programs should be individualised and accounted for pain, stability and functional limitations. Treatment should include a combination of aerobic resistance and flexibility exercises in the elderly with arthritis. If you have any questions, please feel free to email me on the following email address. These are the references used during my presentation, and thank you for listening.